let's talk for a moment, just from I guess from a practical standpoint. Do we understand the adherence of clinicians to use these tests? And whether that's clinicians like orthopedic surgeons or physical therapists or even other extenders, general practitioners, do we have an idea as to the utilization of the tests in general? And is there a wide variation as to the use of the test and the adherence to any knowledge of whether they're reliable and valid? Eric, do you want to comment on that?
Yeah, sure. I think, as you might guess, it's probably all over the board. I'm not sure that every person is using them, using the best tests and discarding the tests that aren't good. There's very often an argument from clinicians that it's about individualized care. So maybe the test works well with this one person. Not sure I buy that argument in this case, but I certainly understand that argument. I think also people modify the tests a great deal and do them their own way. And at that point, you've kind of deviated from, which isn't a bad thing. This is how creativity and new tests come about, but you've deviated from the original description of them. We therefore don't know what the sensitivity and specificity of them are when you deviate from the test. Those are my thoughts. But the short answer is I don't know if we know that every clinician is using the best tests. If they are reading, that information is certainly out there now more than it's ever been. Chad?
Yeah, I would agree with that. I definitely think that it's better than it used to be, because we used to have no parameters to go by. It was the Wild West. It was free range chicken of tests. Anybody could use anything and claim it for what it is. I think we've seen some strides in the right direction. I know that Eric and I have both been invited to speak to physician groups, chiropractic groups. I was actually invited to film a library of tests for a chiropractic college because they had an interest in improving their selection of tests in that clinical examination. I will say this, we looked at the use of clinical tests in 2019 in a particular study, and one particular test, the active compression test, which is sometimes known as the O'Brien's test, it's a really lousy test. But 77% of orthopedic surgeons currently use that in clinical practice. So I think the hard part, Jason, is once these are adopted in clinical practice, it's really hard to divorce yourself from them if you're using a particular test that doesn't have any diagnostic value. And I think that's one of the values of our test, of our book, is it actually frames which tests have value and which tests don't.
Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.